Bridging technology and innovation that unlocks and empowers compassionate care is a passion that drives many of today's pioneers in the healthcare industry. Our next guest, Dr. Jake Lancaster, embodies this spirit as a Chief Medical Information Officer at Baptist Memorial Healthcare. With a unique blend of medical expertise and informatics knowledge, Jake is at the forefront of leveraging technology to enhance patient care and clinician experiences. From implementing virtual scribes to navigating the complexities of AI integration, he's tackling the industry's most pressing challenges. While together, Jake also shares his journey of being the author of The Matter of Medicine and why he enjoys bringing his creative perspective to healthcare transformation. Join us as we explore how Baptist Memorial Healthcare and Dr. Jake Lancaster is embracing cutting-edge solutions to reduce administrative burden, improve efficiency, and ultimately bring more joy back to medical practice for clinicians and patients. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us. Hi, Dr. Lancaster. A warm welcome to our podcast today.
Thank you, Mike. Glad to be here.
Well, given your passion and mission to improve the clinician and patient experience in healthcare and how technology can aid in this journey, I'm excited to have this conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Jake, it's almost time for our community to learn how you and the Baptist Memorial Healthcare team are leveraging technology to serve communities in the Mid-South by offering safe, integrated, patient-focused, high-quality, innovative, and cost-effective medical care. Additionally, I can't wait for you to share a bit more of your book, The Matter of Medicine. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Yeah, so the one piece of advice I would give would be to remember why you're passionate and not to lose focus. It's very, very easy as you get further along into your healthcare journey to get distracted by something new or the myriad of problems that are out there. But always go back to your North Star about why you're passionate. Keep that focus for as long as possible.
And Jake, does that also include in that journey to ensure, yes, we want to do that internally and for ourselves, but is it also, important to find others to take you and be, walking shoulder to shoulder in that journey? Because like you said, this is tough. This is a tough industry. It touches every single one of us, whether it be personally or professionally. Is it important to build that network around you of folks to help you aid in that journey and vice versa to help them as well? What has that been like in having that strong network of leaders around you as well, Jake?
Yeah, you cannot do it alone. If you're the only one in your organization that's passionate about a particular subject and you can't convince others, you have to join you along that journey. It's going to be very difficult for you to enable change. So certainly find the people that share your passion. There's thousands of different passions in medicine, but find those within your community that synergize with you and build that community and keep going. Because with more and more people all acting in concert together, you'll have a greater impact.
And did you notice that passion when you kind of first started, interviewing with and joining up with the Baptist Memorial Healthcare team? Did you notice that with some of the leaders that were there as well? And is that continuing to carry through today?
Yeah, so it probably started even before I was at Baptist. When I first got into the technology side through clinical informatics fellowships at Vanderbilt, we had a community and still do of clinical informatics fellows and alumni that still share Slack today, but meeting them for the first time, understanding why they got into it, understanding, being able to bounce ideas, answer questions, and share different tactics within that group has been incredibly helpful to this day. I still join it, even though it's, been several years since I was a fellow. That core community of people were still friends, and it's great to see them and, kind of keeps my North Star for me.
Well, we're going to talk about that North Star. We're going to talk about that network of leaders that you continue to lean upon and how, you got into the informatics space. It's a fascinating and fast moving area within healthcare. We're going to discuss as well all the wonderful things happening at your health system, discuss a little bit of how you became an author as well. We're going to unpack all of that and more after we get back from thanking our community champion sponsor. Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow. All right, we are back with Dr. Jake Lancaster, Chief Medical Information Officer at Baptist Memorial Healthcare. Jake, thank you so much. You teed us up perfectly on the front end, talking about your passion, talking about your North Star. It's a tough industry. A lot has been changing. There's been a lot of upheaval, a lot of disintermediation, a lot of disruption, and especially a lot of that happening in an accelerated fashion on the other side of this pandemic. Some of it good, some of it bad. But let's talk about the industry. Let's talk about how you got into it, obviously being a medical student, and then bolting on top of that, some informatics work. Would love to hear more about that. How does a leader like you even get in that in the first place? I know we have a lot of, aspiring students and leaders looking at this space. So this is a perfect time for having you on here to delve into that conversation. Of course, I got to ask more about the book as well. And then see where things are going. What are you seeing from the captain's chair? A little bit of that crystal ball as well. And then from there, of course, we've got to ask how we can be helping you out. But Jake, take us back a bit. How did this all come to be? There you were, a medical student, and then you got into the fellowship, got a little bit into the informatics work. Share with us a bit of how this all came to be and why this is your now North Star and your passion.
Yeah, so certainly did not think when I was a medical student that I'd be doing what I'm currently doing, like most probably in my role. But when I was a medical student, I was always interested in healthcare leadership. It's just kind of how I was growing up, and was our student body president. And at that time was during the Obama administration with the Affordable Care Act, a lot of changes taking place in healthcare. And I knew that I wanted to be in a position where I could affect change and not just react to change. So when I went to residency, did internal medicine residency, I knew I needed to learn more about the healthcare system outside of just the clinical aspects. So I did a master's in health administration to really try to get a 360-degree view of what American healthcare looked like. That being said, I don't think anybody really has that complete view. It's still just so complex of a subject, and you're still learning every day. But it was during that master's in health administration during residency that I began to realize that health IT was playing a larger and larger role within healthcare, and knew that that was kind of a blind spot for me. I did not have a background in computer science. I was maybe the family tech guy for sure, and a physics major that understood a little bit of programming, but did not understand how technology in and of itself was going to affect the healthcare system, and knew I wanted to learn more. So one of our courses was on health IT during the Master's of Health Administration. And at that time, I was going to be a cardiologist. That was what I was going to do. But I started looking into, were there opportunities for further training more on the administrative IT side that I could participate in addition to potentially doing cardiology. And I found that there were these clinical informatics fellowships that were popping up. And when I applied, I think there was 11 in the country. Now there's over 40. And, there was 0 in the Southeast, but 1 was forming at Vanderbilt. And so I thought about it long and hard. I, dedicated all my research and everything to cardiology, but really knew at my core that I had this other interest that was maybe bigger than what I could be doing as a cardiologist, and be able to affect things systematically versus a one-on-one patient interaction. So I, to the dismay of maybe my parents and all of my friends, put aside doing a fellowship in cardiology and applied to be an informatics fellow, the first one at Vanderbilt. And it all stemmed from that decision, where I am now doing the fellowship there, getting really a great in-depth view of what healthcare technology informatics looks like at a health system level. What are the innovations? What are the bread and butter things that are coming out there? What are the ins and outs of how decisions are made? governance. So it all started there. And then from there, I gave up on the cardiology dream. I had said I was going to do the fellowship again after I did that informatics fellowship, but I put that all aside and became the CMIO of a medium-sized healthcare system in Jackson, Tennessee, West Tennessee Healthcare, and then was recruited to Baptist, where I've been the CMIO for the last 5 years.
Oh, how exciting. Well, sometimes you got to give some things up in order to let other areas fly. And it sounds like you're all in with the work within the CMIO world. So Jake, let's talk about current state as well. Then obviously here you are now in a leadership position with Baptist. Maybe we can discuss a bit. Who is Baptist? Who do you serve? Why were they recruiting you? What does this role of Chief Medical Information Officer mean to Baptist? And of course, most importantly, to the patients that you serve. Maybe we can start there and we'll springboard off of that. Maybe share a bit more. Who is Baptist and what does the role of CMIO mean to the organization?
Yeah. So, first I have to start off and say there's several Baptists around the United States, but we are based out of Memphis, Tennessee. We're 22 hospitals, mostly located in West Tennessee, Arkansas, and Mississippi. We also have 185 clinics across that 3-state region as well and continue to grow. So, we serve urban areas, rural areas. We serve the Delta, which is a very challenging population, a lot of underserved communities within this 3-state region. So as the CMIO, my task is really to optimize the technology for our medical staff in order to both, improve their efficiency and happiness with the system so that they can take better care of their patients and the patients have a better experience and a higher quality care experience. So that's really what I'm tasked with.
And when you were recruited, Jake, was there a CMIO previous to you? Was this a net new role? And also, if there was somebody previous to you, did this role change? Because you know as well as I do, Jake, things are moving quite fast. And this whole world of IT, this world of technology and innovation that sits right on your desk is changing rapidly. What did it look like before you were there and then where you are today? And then, of course, we'll discuss where things are heading tomorrow as well.
Yeah, so there was a CMIO before me that had retired and I came in to fill his role. He was there from really the beginning of their implementation of our major EHR Epic across the system. And so I came in really as an opportunity to optimize what was currently there and build more of a core informatics team that could go out and continue to own the work that he did while also bringing in maybe some newer components, some different ways of thinking, some more. Since I was, formally trained in informatics, I had a little bit more of a strategic and structure in mind for what it should look like at an organization-wide level that I could bring in.
And how has this role of the CMIO changed from when you first started, even just your education, your fellowship at Vanderbilt to today? What are some of the big things that, the big rocks that you've seen that have moved, maybe have not moved? Where have you seen things been over the past few years?
Yeah, it's been kind of a wild last 5 years. So when I came in 2019, September of 2019, 6 months later, we had COVID and my role changed dramatically. I went from really focusing on optimizing the technology for the physicians. I still had to work on that, but now it was more, how can we change our technology to react to the needs of the system for the pandemic? And that, building out things in the EHR, building out telehealth capabilities, reporting capabilities, and, some predictive analytics type things, what we needed to do from that standpoint. That was a busy couple of years. And, it lasted a little bit longer than that in some cases. And it just always kept coming back and going forth. But that was the majority of my energy at that time was dedicated to that component. At the same time, we had a big new law, the 21st Century CARES Act and the information blocking rule were put into place. And so helping our physicians understand the requirements from a healthcare system and provider standpoint related to that law that were new and unique and challenged prior clinical practices. And I still get questions about it. Everybody is more on board now, but that was a big thing that happened back in 2021 that people forget about. We also had updates to the E&M coding guidelines for outpatient and inpatient that I had to help our system navigate. And then, more recently, it has been all AI. In addition to bringing a new healthcare system or a new hospital system live on Epic within us, we're introducing new AI capabilities throughout the system. And that's kind of where I am today, is helping our system navigate these new solutions related to artificial intelligence, be it the ambient scribes or functionality within Epic, and helping us do that in a safe, equitable manner, as well as get it to our physicians as fast as possible, because it really is serving an unmet need for us.
And Jake, let's also talk about more of the softer side, if you will, from your experience and your colleagues' experience of going through the pandemic. Of course, a lot of in a big reactionary mode as an industry, understandably so. But on this side of the pandemic, have you seen anything, culturally or how we think about things on a kind of societal level have just been completely shifted by way of need from the pandemic, in regards to think of like, what is the art of the possible versus how we used to always think like we had to have, and I'm just going to say it, I don't mean to offend anybody, but we'd always have to have a meeting to have a meeting to have a meeting, and then nothing would get done, and we'd just sit and talk. But then all of a sudden, the pandemic forced us to actually do things. We went from pilots in telehealth that would take 18 months just to get a meeting and maybe one site to get a pilot going to literally turning on an entire telehealth application almost overnight, system wide. So we know that things were possible to do. Has that carried forth through the pandemic? And is it still with us today? Or maybe have we, recoiled back? So think about it again from the soft side. How have things changed in regards to how we look at things, especially from your seat as a CMIO on this side of the pandemic?
Yeah, we had that same experience where we were able to do things that would have been thought impossible, very, very, very quickly because we had a singular focus as an organization. Now, as the pandemic has subsided, the focus is not there anymore. Everybody has their own priorities again. All the priorities that were put to the side have come back, and we do not have that singular focus like we used to. We actually had talks about how can we continue this momentum going forward, after COVID? How can we keep these same structures in place to allow this forward momentum? But honestly, there's just too many different things that continue to distract. And that's why I go back to, the beginning where I said, don't lose your North Star, your focus. It's very, very easy to get distracted by the problem of the week or the thousands of other requirements that are out there for healthcare systems or individuals. So, to me, I don't think we could turn on a dime like we did at that point right now, unless the focus was added back.
Well, let's switch gears a bit. Before we take the crystal ball off the proverbial shelf over here, Jake, and look a little future state of what you're seeing from your captain's chair, if you will, and how we should be thinking about those items that are coming up on us quickly. Got to discuss your book. It's a fascinating overview that I found online about it, The Matter of Medicine, where it transplants the timeless tale of King Arthur into the harried hallways of Camelot Hospital. Arthur, an unassuming intern, stumbles upon Excalibur, a mystical stethoscope entrenched in a stone doctor's bag. And with that, he unravels medical mysteries that confound his peers. Jake, how did that come to be? How did you think of this? I mean, this is an absolute brilliant synopsis of this book. How'd this all come to be? Did you know you wanted to be an author? Maybe share a bit more about the journey of being an author and a little bit about the book.
Yeah, my dad had written a book when I was younger, and it kind of, stirred me to become an author as well. I'd always been interested in writing when I was in high school, but set it aside really when I, went to medical school and knew that, at some point I wanted to write a book. Didn't have any idea of what that would look like really until I got to in residency, as part of this master's in health administration. Again, just really gave me some time to reflect and think. And, I was reading T.H. White's The Once and Future King at the time when I was on vacation, which is, a more modern retelling of the King Arthur story. And I just had this thought that, hospitals are a lot like castles. There's these big, large places full of knights, well, this could be doctors. And, instead of fighting out on the field, we oftentimes have sieges where, people will come attack hospitals. Well, that's kind of like how we take care of patients. We don't take care of them where they need to be taken care of. We take care of them within the hospital. And so at that point, the analogy just kept going in my mind, and I had a lot of time. I was on vacation at the time just to explore the story and continued it forward and thought, well, if Arthur were a doctor and he remade the, Camelot, was the first king of England and really reshaped that entire landscape of what that looked like, what would he do in medicine? What could be done there? And so there's a million problems in healthcare, but it's so much easier to fix it when you're writing fiction and you can do it in a piece of paper. So that's what I ended up doing, was sketching out a story about, if there weren't all these different laws and regulations, different things that were stopping you from actually delivering what great healthcare could be, what would that look like if you had a magical wand or a Merlin, your wizard, that could fix things for you? And yeah, that was kind of the inspiration for the story. And through out fellowship, and really I read it over the course of 5 to 7 years, just a little bit at a time each day, partly based on my experiences and partly based on a lot of it based on the King Arthur legends, put it together in something that I thought was both a modern retelling of the King Arthur story, but it also just an analogy of what this could look like in healthcare.
My gosh, I absolutely love it, Jake. Thank you for sharing that. And for our listening community, where can they grab a copy of the book? Where should we direct them towards?
Yeah, so it's available on Amazon, and there's also an Audible version as well.
And were you the voice for the Audible version, Jake?
So it's interesting. Yes and no. So I cloned my voice with 11 Labs and used that cloned voice to actually, generate the text of the book. So it may not sound as natural as me reading it off, but it's as close as I'm going to get right now. Eventually, maybe I'll set some time aside to actually do the recording myself, but it was a daunting task to actually do it.
Well, there it is, AI popping its head up again there in the personal level and for your own book. How cool is that? Well, for our listening community, we'll leave a link in the episode notes to click on through and head over to Amazon and grab a copy of that book as well. So thank you for that, Jake. Well, we're going to take the crystal ball off that shelf that we were discussing. Let's look a little future state, Jake. As we mentioned, things are moving quite quickly. We're seeing technology and innovation coming at us at breakneck speed. What are you seeing a little bit, and maybe even your peers, what are you seeing kind of from the cockpit, from the captain's chair, if you will, on the macro for the system? And then, of course, and you kind of already teased it a bit, what are you seeing happening and what are you wanting to bring into your health system? Let's call both things over the next 2 to 3, 3 to 5 year time horizon.
Yeah. So, what I've seen and what I've seen others do almost, I've been at 2 conferences over the last 2 or 3 weeks. Almost every health system I've talked to, all the CMIOs are implementing virtual scribes. It's just almost unanimous. And so, there's 20 companies out there, but there's really just a handful of leaders that people are choosing. That's going to be what we're doing probably for the next 2 to 3 years, I would say, because it's going to start on the ambulatory side. It's going to grow to the inpatient side, ED physicians. And this is new technology that we are adopting very, very quickly. And really, it is not fully baked. It's really just beta versions that are going to be improved upon. And it's very strange to have this rapid deployment of a software solution that is, again, may need a little work. But the benefit of it is so great. This is the first technology that I've introduced for our physicians that has saved them, saving from a minimum of about 30 minutes a day to as much as 90 minutes to 2 hours a day per physician per day, which is a staggering amount of money considering how much a physician's time is worth. So, and also for advanced practice providers. And so that is coming, that is here, that is going to be rapidly expanding. If you've not been to a doctor's appointment where they're using it, you're probably going to see it within the next 1 to 2 years. And then it's going to come to the inpatient side. It's going to come from nursing. All of these documentation, administrative tasks that we are doing that is burning out our physicians and our other staff are going to be replaced by this. And it is the most welcome thing that we've had. It's the most satisfying project I've worked on in healthcare right now. It's the only one really where I've gotten thank you cards and the like from putting it in there. So that's one thing, the ambient scribes that are becoming. Then there's hundreds of other little products that are similar that are going to be baked into the EHR. I know we use Epic. Epic's working on 20 plus different models within the EHR to help reduce and automate a lot of these tasks. I'm sure other EHRs will be doing that as well. And so you're going to see quickly that a lot of the administrative tasks that waste so much time are going to be automated. And that is going to be a paradigm shift for healthcare, is going to be something that puts more of the joy back into practice that has been gone for almost a decade since we've introduced EHRs and the like into practice. And something I'm very excited about. Now, the problem is these things aren't free. We're going to have to pay for them. But right now, everybody's doing the calculus and saying, yeah, it's certainly worth it. And we have to do it, or else we're not going to be able to recruit physicians to our practice because everybody else is doing it. We don't want to be the ones left behind.
Well, thank you for that, Jake. A very exciting future indeed. And like you said, the future is now. It is coming at us very, very quickly. And leaders like you are helping that new dawn and that new era come to life quickly. And it's important because we need to get past this administrative burden and cognitive load that has been on our practitioners for years. It's time to change course. The technology's here, and now is the time to do exactly that. So thank you for that, Jake. Let's now get back to current state. Of course, we'll always love to help our guests out with our audience. That is an amazing group of folks that tune in on the weekly. What's one problem, need, or question that you and your team at Baptist have that we can be helping you with?
Yeah. So the problem that you can help us most with is how to pay for these innovative solutions. Like I said, they're coming. There's hundreds of great solutions out there that I get pitched on a day-to-day basis, but they don't necessarily align with how we get paid as a system or how a physician gets paid. And what I'm asking you to solve is to fix the cumbersome way that we pay for healthcare in the United States. So that's a small problem that if you want to take on in your spare time, that would be greatly helpful for everybody. I think everybody knows or should know. If you don't, if you're getting into the space and do not know how healthcare is funded, how things are paid for, that's where you need to start. Follow the money is key to understand why somebody's not adopting your solution. It's mainly because it doesn't either help reduce costs or bring in additional revenue, even though it may do something fantastic. I think ultimately, in order to get to the dream healthcare scenario that maybe I write about in my book, that has to be fixed, or underlying mechanism for how we pay for things in the United States. No small problem, but you have a lot of passionate listeners, and I think if somebody was going to get into the space and really make a difference in healthcare, solving that would be the key.
Well, in order to have those conversations, because they're important ones, Jake, how do they get a hold of you? Contact points online, social media handles, websites, or otherwise? How do they track you down?
Yeah, I'm most active on LinkedIn. You can find me there, Jake Lancaster, MD. I do get on Twitter or X, but I don't post as much as maybe I used to. And yeah, those are probably the best ways to engage with me and reach out to me.
For our listening community, we'll have Jake's LinkedIn profile linked in the episode notes. So simply scroll on down into the episode notes and click on through to get a hold of Jake over on LinkedIn. Also, we will have a post for Jake's episode on our free global online community at passionatepioneers.com. You can also leave comments, feedback, suggestions, or otherwise for Jake there, and get those contact points and that link to his book as well. Again, over at passionatepioneers.com. Jake, thank you so much for taking time to be with our community today and to share a bit of what's happening within your world and how you're seeing things move and moving in a rapid pace, and how we can all act and react accordingly during these exciting and changing times. So thank you so much for spending time with our community. We're wishing you nothing but the best. But again, Jake, thank you for being with us today.
Thank you, Mike.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.